have you been over the last month? Has everything been going okay? Good deal. Let me just grab a pen and some paper real quick, okay? So, of course, you're trying to meet that deductible. So, we're just doing our monthly check-in here. Like always, every time we meet, I'm just gonna ask you a few questions just to make sure that everything in our database is up to date, okay? Great. So, has the address changed? Okay. Good. I'm glad you like living there. And occupation, still the same? Okay. I see. Would you say that your occupation causes any kind of stressors on you? Do you have any trouble sleeping at night or with your appetite at all? Okay. And how often would you say that happens? Okay. Yeah, I understand. That does sound like that would be a little bit of a stressful situation. Okay. Now, do you have any new symptoms or any new pains or illnesses that you've experienced over the last month that we didn't talk about in our previous session? Okay. And when do you typically, have trouble breathing? Okay, not that frequent. And it's typically after exercise. Okay, I see. Now, on a scale of 1 to 10, 10 being you can't breathe at all, and 1 being some minor discomfort, where on the scale would you say your difficulty breathing lies? Okay. I gotcha. Any other kind of issues you've been having over this last month? I see. Okay. Well, we'll look into that today and definitely make sure that you are in tip-top shape. So, like always, we want to be sanitary. So I'm just going to put on these gloves here and make sure that we're not spreading any germs or any kind of possible illnesses, okay? Okay, now I'm just going to come in here kind of close and I'm just going to look into your mouth if you don't mind. I'm just going to depress your tongue here and just give me a big ah. Just say ah. Okay, yes. Very good. Okay. Yeah, everything in your mouth seems okay. I'm just going to kind of feel the sides of your face here a little bit, okay? Just hold your head still and try not to move. Okay. Very good. Very good. Okay, very good. Well, everything seems normal so far. I'm just going to have a quick listen to your lungs since you said that this was like an issue for you. So, I have my stethoscope here and I'm just going to kind of come in here very closely and I need you to just do a big inhale. Very good. And how about here? Big inhale. Very good. And over here, big inhale. Okay, I'm going to get the back of your lungs here, so I'm just going to come Your lungs sound perfectly fine. There is a chance that you might have exercise-induced asthma, but before we get into all that, I'm just going to run a few more tests just to make sure that everything is functioning normally with you, okay? All right. I have a blood pressure cuff here. I'm just going to put this on your arm and just get a base blood pressure reading for you, okay? So just don't move. Okay, I'm just going to slip this on your arm here. There we go. Is that too tight? Does that feel okay? Okay, great. And I'm just going to start, pumping up the cuff. If at any point it feels too uncomfortable or too tight, just let me know and I will loosen the pressure, okay? So just hold still. Yeah. You're doing great. Okay, now just hold still while I get a reading here. Very good. Just keep holding still. You're doing great. Okay. Yeah, blood pressure is 100/70. It seems to be perfectly fine. I'm just going to run a few more tests here on you. So on the end of my pin here, you'll see that there's a little light. I'm going to turn this light on here in just a minute and run some tests with your eyes to make sure nothing's going on with your vision. And I might also, look in your ears and your nose and your mouth just to make sure everything's okay, all right? So I'm just going to turn this on. If it's too bright, just let me know. So here we are. I need you to just follow this light right here. Okay, wherever the light goes, follow with your eyes. Very good. Very good. Very good. Very good. You're doing great. You're doing great. Doing great. Doing great. You're doing great. Okay, that seems good. I'm just going to look in your ears here, so just hold your head still and don't move. I'm just going to look in your ear here, and it seems to be good. Okay. I'm just going to come over to the other side and look in this ear here. So just hold still and don't move. Yeah, you're doing very, very good. Okay. All right. Now, I'm just going to look in your nose here, and that seems to be clear. And then just like before, I'm just going to depress your tongue, and I need you to just look and say, ah. Okay. Very, very good. Good deal. All right. Well, you seem to have perfectly fine health. I don't see anything that is too alarming right now at this moment. Of course, when you come back in the future, we will monitor all of this and, make sure that these problems, these issues that you're having don't become a bigger issue. The best medicine is preventative medicine, so we will work on that. I want you to do something while you're gone for the next month before you see me again. And anytime you're exercising or maybe doing anything physically, aggressive, just monitor, maybe on a piece of paper in a journal or something like that, if you have any tightness or difficulty breathing immediately following that exercise, okay? Yeah. Okay. And what day would you like to see me again? that will work. Great. Yeah. Okay, well, I wish you the best day, and I will see you again in about a month, okay? Have a great day.